Hello, my name is Alexandra Quast-Cadavid, and I'm going to be discussing substance use in children and adolescents. As a small introduction to the presentation, I want to discuss what we might be discussing within this presentation. We're obviously going to discuss what children and adolescents might have to endure when struggling with substance abuse issues. I think a lot of people view children and adolescents going through this phase as like a party phase, when in reality it can be a lot deeper than that. And I think pushing it off as just a party phase without correction or discussion can definitely lead down a road that can be very damaging to the child. Some risk factors of substance abuse for children or adolescents. A lot of the times when you see children and adolescents starting to act out is when major transitions in their life begin to happen, such as a divorce or moving away from friends and family, such as a support system. Family influence can definitely have a huge piece in it, such as having a parent with a history of substance abuse, mental illness, criminal behavior, also developing within that fight or flight due to this parent, and lacking the presence of a responsible adult within the household and not having someone to guide them into their adulthood. Peer pressure from a friend group is definitely a huge factor within substance abuse. And also struggling with self-esteem and not building that self-esteem at a young age can definitely falter them into falling into those friend groups, as well as like poverty and community, interpersonal violence, violent behavior at a young age. These are all definitely prerequisites for what happens with a lot of people who are struggling with substance abuse. What could be the barriers for further treatment for these children? Cost. A lot of children who grew up in substance abuse households do not have the treatment for the parent, let alone the child, to go to treatment after. Whether that be an IOP level of care or residential or PHP, they don't have the money to attend that. Or they might have not a location near them that can offer these treatment services for them. And there's a huge stigma when a child goes to, say, a rehabilitation center or goes to therapy, because unfortunately, therapy and treatment services like that still have a huge stigma against them. People might view you as air quote crazy, where in our community, that's completely normal. So I would also like to point out, like, my little diagram to the right. It discusses the stigma, it discusses barriers to treatment. A lot of children do struggle with like the denial of the problem and not sure who to ask for help. So that's why I wanted to include this little diagram. Some resilience factors is having that support system and that community support to properly help these children deal with those risk factors that I previously discussed, help them work through that divorce and work through those moving situations and help them through these huge transitions that might be happening in their life. Also, I think a huge harm reduction piece is engaging children, and not even children, educating them into adulthood about substance abuse and what treatments are out there and what drugs truly can do to your life, and not just a DARE program that we have in 6th grade, that it ends there. But that is the end of my presentation. If anybody has any questions, please feel free to put it below in the discussion post. I really appreciate it, and thank you and have a wonderful day.